Hey everyone, Dr. Cody Scharf here, owner of Thrive Spine and Sport in Cedar Rapids.
My name is Dmitry Altshul. I'm the owner of Cedar Rapids CrossFit here in Cedar Rapids.
Today we're going to be taking you through a CrossFit checklist.
In CrossFit, we do a lot of functional movements. That means doing things that are applicable to your everyday life. And the reason we do those things is because you get the biggest change in your body when you do things that you're designed to do. When you do isolated movements on a machine or just movements that don't involve your whole body, you don't get a lot of change. You don't get a lot of response from your body.
So the 5 biggest movements that I find in my office that are most often restricted or lead to the most injuries is ankle dorsiflexion, knee flexion, hip flexion, shoulder abduction, and wrist extension. So today we're going to be giving you an assessment that you can do at home that tests ankle dorsiflexion and a mobility strategy that you can use to improve that.
The squat is one of the most important exercises because it involves your entire body. So we wanted to show you a proper squat first.
Okay, so Dmitry has a great looking squat. As you can see, like we talked about before, the ankle, knee, hip, shoulder, and wrist are vital to this movement. So looking at Dmitry, you can see he's got full ankle flexion, dorsiflexion there, knee flexion right there, hip flexion and a flat back. Great looking setup there. Then to the front rack, we got the hip extension and the shoulder abduction. Okay, so we're going to start with the ankle dorsiflexion assessment at home using the integrative diagnosis system. So to start, we're going to have you, you're going to need a wall and a ruler. Normal range of motion for this test is 5 to 6 inches. So what you'll do at home is you'll come up against the wall, you'll support yourself arm's length away from the wall here. You'll take the affected foot or the painful foot or just either foot if you're wanting to see what your assessment looks like. You'll take that foot, point it forward. You'll have a ruler at home that you need to place along the foot like so. What you'll do is you'll start with the toe flat against the wall right here, and you will drop the knee into the wall, and you'll continue to slide back until your ankle lifts off the ground. So continue to slide back here. 4, good. Let's slide back to 6 there. Good, so stop right there. So as you can see with Dmitry's assessment here, the knee is flat against the post here, and the ankle is flat on the ground. So this falls within the normal range of motion, so that's a nice healthy joint. Now a positive test or a restricted test would be, go ahead and slide up right here. Good, drop that knee into the wall and lift that ankle. So if that, and you can actually drop that down a little bit less. So a positive test would look something like this. The knee touches the wall, but the ankle goes back up.
Hey guys, so we're gonna show you a mobility strategy that you could use at home or in the gym to help with that dorsal flexion in your ankle. So if you have one of these bands, you can tie them to a post. And what Dr. Cody's gonna do is he's gonna put the band right around his ankle. He's going to stretch the band out as far as he can, take a couple steps forward. And then he's going to set his back leg back behind him to support him. This way you don't put a lot of pressure on the knee. And he's going to start moving forwards as far as he can while keeping his heel on the ground. That's really important. And then back. Okay. And then he's going to move forward and back. You can do this for several minutes. The important thing is the band stays right around the ankle, not up high, and then his heel stays in the ground. It's going to feel like your ankle is being slightly pulled apart, and you just keep working further and further in the range of motion. Okay. And then the second thing is if you guys don't have a band, perhaps you have a foam roller or a barbell or anything, a PVC pipe perhaps you can even roll on. We can try to loosen up your Achilles tendon at the back of your ankle to also get more range of motion. So if we have a simple roller here, it's going to hop top of the roller. He's basically going to smash very, very slowly, working from his ankle down to his calf, hitting all those muscles. And you want to move slowly. Feel like creating a pressure wave, kind of trapping a little bit of that tissue over the roller and smashing that out. So if you feel like there's a few painful spots, stay on there and keep rolling them out until it becomes smooth and pain-free, and that's going to also improve your flexibility quite a bit.
If you have any questions with the squat or how to improve your mobility, come see us at Cedar Rapids CrossFit, or visit our website, www.cedarrapidscrossfit.com for more information on how to get started today.
It's important to note that as you go about this assessment and mobility strategy, that if you fail to improve the assessment or you're struggling with pain, that you seek the advice of a medical provider. If you're in the Cedar Rapids area, I would be happy to help. Feel free to visit our website, www.thrivespineandsport.com, or you can shoot me an email at dr.cody, C-O-D-Y, @thrivespineandsport.com, or you can give us a call at the office, 319-423-0925. Be on the lookout for part 2 of this 5-part series for the CrossFit checklist. Thanks for watching.